IKIM Inspirasi Inforia Islami. Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya wal mursalin sayyidina Muhammadin wa ala alihi wa ashabi ajma'in. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahul qawli. Welcome to another new season of Open Forum. Thank you to IKIM Radio listeners who are with us this Sunday afternoon, and Alhamdulillah, as we know, Open Forum has now entered its sixth season, and inshallah we will continue to share viewpoints and insights on the topics of discussion every week, inshallah, to all IKIM Radio listeners. And Alhamdulillah, for today's discussion, we will be focusing on a very critical issue, crucial issue, that is affecting our society today. And we know that this particular issue is not just affecting the society in Malaysia, but it's also a global concern. And to talk about the topic, which is issues on mental health, what does Islam have to say? We have with us Yang Berbahagia Datuk Dr. Azizan Baharuddin, the Director General of IKIM, to talk about this particular issue and to share with our listeners especially on what the kind of issues that are affecting us, inshallah, with regard to this topic. So how are you, Datuk?
Fine, thank you.
Okay. And thank you for being with us this afternoon. And I know that this particular issue on mental health is a great concern, not just with regard to how we are addressing the issue in terms of how we're dealing with certain aspect of the impact of the pandemic in our society. We know that COVID-19 being a pandemic affects us in many ways. It's affecting us economically, socially, and we felt this is another important dimension which is of grave concern to the society. When we talk about mental health, Datuk, there are so many aspects with regard to mental health. But what exactly, when we talk about mental, how do we define? What defines mental health? If you may share with our listeners, Datuk.
Thank you, Puan Neni. Also our producer, Hajiah Maslina, and her crew at the station. Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa ashabihi ajma'in. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Once again to Puan Neni, Puan Hajiah Maslina, and all of our friends out there. Assalamualaikum warahmatullahi wabarakatuh, and our great thanks be to Allah for allowing us to share this forum today, speak on a topic which you have introduced as being something of critical importance to us today. It's very close to us. It may affect any of us.
Yes.
So we may probably, to start the ball rolling in terms of talking about this topic, make a few clarifications. Firstly, we are not the experts, right? If and when someone is really in the situation where he suspects or others suspects that he really needs help in terms of his mental health, then they should seek the assistance of the real professionals. And Hajiah Maslina, we are all very happy to add here as well. She has been conducting similar programs on mental health for many seasons, for many months now, a couple of years, I think, Hajiah Mas, in Bahasa Malaysia. And also currently, IKIM Radio is also conducting many programs, especially in the morning section, that touches on some of these issues as well. So for our listeners, friends out there, if you have the time, please follow us and please expand the positive messages that we want to share. WHO defines mental health as a state of well-being in which the individual realizes his or her own abilities. These individuals can cope with normal stresses of life, and underscore the word normal, Annie, can work productively and fruitfully, and is able to make a contribution to his or her community. This is, to use common parlance, common language, a normal person. Everybody undergoes stresses. So, when it comes to emotions, how we perceive what we suffer, quote unquote, in terms of our feelings and all of that, let us be quite straightforward in saying that do not expect a totally stress-free existence. There's no such thing. Because sometimes in this day and age, when people are so used to instant gratification, they have zero tolerance, almost very little tolerance towards anything that is making them unhappy or uncomfortable. And this goes especially with the younger generation, those who are born with silver spoons in their mouth, those who do not undergo real difficulties in life, and all of that. Yeah. So WHO also, World Health Organization also defines mental health as subjective well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and self-actualization of one's intellectual and emotional potential, among others. So just now that was talking about just the normal baseline condition. This one talking about potentials, competencies, the feeling that you are an autonomous person, that you have some kind of independence to make decisions and stuff like that. That is all part of mental health. So you can imagine the moment all these things stop being experienced by ourselves, then mental health issues are beginning to set in. Yeah? So from the perspective of psychology, for example, mental health can include an individual's ability to enjoy life. So the question now is, are you enjoying life? That is a big question which you may follow up later. It's a relative term. What do you mean by enjoy? What is it that you want to enjoy and all of that? And to create a balance between life activities and efforts to achieve resilience. Yeah? You have to be able to achieve balances also in terms of what you're doing, all towards what goal? To achieve resilience. Because your life changes, your life conditions changes moment to moment even. So then I think alongside all of that explanation, I think we need to understand what do you mean by mental health disorders. Yeah? So these are defined as the health conditions that affect and alters cognitive functioning, emotional responses, and behaviors associated with distress and impaired functioning. Maybe as we go along, we will demystify all those big words, right? But for the moment, we just remind ourselves that this is how the authority, World Health Authority, define these mental health disorders. So, what are factors affecting mental health? Diet, as simple as diet, as simple as exercise. And then we go to stresses, then we go to drug abusers, and then we go to social connections and interactions. So it's both physical, ranging from physical to social, to our relationships with other people. So it could be that to begin with, we're just normal, we're okay, right? But the moment we fall short of that balance we're talking about, between autonomy and having social interactions and connections, then maybe problems can start coming in also. Yeah? For example, people working at home, people who are asked by their employers to work from home, for example. Yeah? So then some people complain of isolations, and some people say, of course, we must go back to the data, some evidences. Some people say that it's because of this stay home instructions. They have been led to extreme loneliness, and then they have been led to even suicidal situations. So then there's a lot of that. But can you see what's important here is to be literate about mental health. We need mental health literacy. Just like we need to be literate about what vitamins, what vaccines we have to take. We have to be very, very careful about the condition of our mental health. So treatments and management of mental health include therapy, counseling, and of course medication. So let's not confuse and also right from the beginning be very upfront about this. Some conditions do require medications. So before we delve into the question of Islamic perspectives, where we'll be talking about prayers, we'll be talking about zikir, salat, and all of that, we must be clear that some conditions, you do all of those things that we mentioned, but you must also respect the modern, the conventional, elements of that are necessary in keeping your mental health, which is medications. So why do we speak? Why do we emphasize? So worldwide, 450 million people are suffering from mental health in the form of major depression. And major depression is itself number 4 among the top 10 leading causes of diseases, number 4. So that's very, very high. So by 2029, mental health is predicted to be the leading cause of disease by 2029. That's only 8 years away.
Yeah.
So could it be that this is a projection based on the pandemic situation? Maybe, but we can of course refer to what they call it, valid sources for all these kinds of information. And 1 million people commit suicide every year, and between 10 to 20 million attempt it. And in Malaysia, in 2021 alone, we read that 112 people on the average commit suicide per month. And this is unheard of previously. Yeah? And so evidence from WHO also estimates that nearly half of the world population is affected by mental health. So how dramatic, how much more dramatic you want the situation to be before you take heed of what's at stake here. Yeah? So the impact is, of course, on self-esteem, on relationships, and ability to function in everyday life. We may not think self-esteem is very important, but it is critical. So at the most basic level, everybody, even babies, I think, as soon as they are develop a sufficient awareness, have self-esteem. And it is connected with how they're handled by parents, by teachers. So it's important people have empathy and love and warmth towards each other. And connected with these are things like relationships, friendships, colleagueship when we are at work, boss to worker relationship. All this have to be taken care of. So if all this while we are so careful about sanitization of the equipments around us, wash your hands with soap and water, wear masks. So we realize now that in terms of mental health, there are also codes of conduct that we have to take care of, that we have to practice, so that our emotional health, our mental health is not what they call it affected. So not to take too much time. Of course, mental health is packed very much to emotional health. So of course, like as we said earlier, we are not experts. But I think today there's a lot of information available, and you can always go to valid sources to understand more of what we are touching upon today. And we have to understand that we need to be empowered, because during these times you're not allowed free movement. So most of the time you need to be aware of what you are going through. So I think in the Islamic tradition, but maybe before we go to that, you may want to ask us, you may want to pose other questions about mental health.
You've basically mentioned about how it is important to be literate about mental health, not just from the perspective of understanding how it is defined, but from the numbers, the numbers that you have shared with our listeners, Datuk. It gives us some sort of shows us that there's a grim situation happening.
It's a pandemic of its own.
That's right. And when we're talking about this mental health issues, it is somehow considered a taboo in many societies. Because of the connotations that come with it. Especially, there are words that are being used to describe people who are affected with this situation. How should we deal with this misconception, so that people would understand how to help those people who are facing this?
Okay, bottom line is, just now we mentioned the word literate, right? So literacy there is about all the dimensions, or as many dimensions as possible connected to mental health. So one of them is what you've just rightly pointed out, the issue of taboo. Sometimes because of taboos, because of cultural situations where people look down, where people stigmatize, individuals and families that are connected with mental health, people keep quiet. People don't go out to get the help that they need to get immediately, for example. So firstly, we need to understand that mental health is a socially constructed and socially defined concept. Right? Therefore, in other words, in different societies, or in different groups, or in different cultures, or in different institutions and professions, we have different ways of conceptualizing its nature and causes that determine what is mentally healthy and deciding what interventions are appropriate. Yeah. Well, I think it's not taking too much from our imagination. It's not too difficult to imagine, for example, yeah. Um, if let's say in a household where you have on the average, because of genetic factors, maybe everybody talks loudly, for example. Yeah, and they have slapstick kinds of slapstick comedy types of mannerisms of communicating. So another family which is totally different, brought up in different setting and all that, yeah, they might perceive each other differently, you know.
Yeah.
Uh, so it can range from something that is so innocent to something that's really deep. And some people, they parade as if they are the epitome of calmness. But lo and behold, yeah, just a little bit of provocation, you have a tsunami in your face, right? So, in other words, what we're trying to say here is be cool about it, be calm about it, and most critical, and this is what religion would ask us to do not judge others. Do not be quick to judge others. And certainly in terms of mental health, it is a complex situation, and you don't know whether it's just surface condition or whether it's really deep seated. Okay? You've heard of psychopaths before, right?
Yes.
You've seen the movie The Psycho, for example, right? So it's very not easy to talk about what is mental health. Therefore, the last thing you need is to stigmatize and to create a taboo out of it, which will hinder yourself as an onlooker, which will hinder the person who's actually involved and his family and all that from doing the right thing. So research shows that stigma is attached. Stigma is very much attached to mental illness, and therefore many people resist in the attempt to resist labeling. Yeah? They don't want to be labeled as a mental quote unquote person. They resist treatment, and they go through the phase of denialism. They deny it, and so and most critically also, it becomes something that is quite serious when the families start to imbibe this feeling of being stigmatized, and then they are cowered into a situation where they don't take an active role in helping the person who needs the help. So we need to address this situation via education for the public. Maybe our colleagues at the radio station can do capsules on this. We ourselves, as in the context of our nature of our work, we can contribute articles in the local newspapers, as we've done on many topics. And therefore, there is, for example, the need to know what is mental health, what is mental illness, what are the factors that causes it and that triggers it. And maybe today, in the short time that we have, just very briefly, some of the factors that causes mental illness is economic. For example, unemployment has been shown to hurt an individual's emotional well-being, self-esteem, which leads to depression and serious disorders. And then there's what you call emotional disorders. Just not was economic, and so apparently there is something in a cluster by itself, emotional. So we know that we have a spectrum of emotions that we suffer every day. You can easily find out what are the emotions, and the usual ones are anger, sadness, fear. There are 5 major ones. And in between these major ones are subsets. You may be suffering fear and disappointment together, 50-40, whatever it is. So it's very critical to have emotional intelligence. For example, what am I feeling? Why am I feeling that feeling? Okay, and then the cognitive elements comes into the picture. Is what I think that I fear, is it truly so? The moment you are, let's go back to unemployment situation. Okay, the moment you're fired, so what is the greatest fear? no more money to buy food,
Mm-hmm.
right? So this is where we have to think like human beings, not like automatons.
Mm-hmm.
You have neighbors, you have people who are willing to help. So this is where the issue of compartmentalization of knowledge also comes into the picture.
Mm-hmm.
We are not used to, and also the situation where the society has been living in atomic units, separate from each other. Things
Yeah.
like neighborliness, things like, neighborhood, good relationships. Yeah, we always talk about the good old days when we were living in the kampong, where
Mm, yeah.
there was no fences. You can
Mm.
literally shout to the other house.
Yes.
Sepelaung means, oi, like
You
laung.
just call out and
And
it's the other
call out, and
person.
people. So where has that gone to?
Mm.
So of late we hear about the white flag
Yes,
phenomenon.
campaign.
Yeah,
Yeah.
yeah. So I think, and some people become dramatic about that,
Mm-mm.
whereas it's just a natural instinct of a human being to ask for help.
Mm-hmm.
Like
Yeah.
if you're suddenly somebody's house is on fire, 2 a.m. in the morning, what do you do? Just
Mm-hmm.
keep quiet because you don't want to disturb your neighbors. Surely not. So
Mm-hmm.
you'll be laung and laung and all, red flags, white flags, and that is natural, is it not?
Mm,
So
yeah.
emotions include, of course, feeling of not needing other people, feeling of
Mm-mm.
being aloof,
Mm-hmm.
what in Islam we call sifat-sifat, the sifats of mazmumah,
Mm-hmm.
sombong. I mean, being proud, being too proud, all this.
Mm-hmm. Mm-hmm.
Maybe in a later situation, later time we can dwell on that. So
Mm-hmm.
emotions is really big deal,
Mm-hmm.
because at
Yeah.
any one moment you are dealing with a million types of emotions.
Yes.
Not exaggerating. I mean, like, there's so many types of emotions that can come your way, and it's very important that you have knowledge to understand that you have to pause for a while. When
Mm.
you feel a certain emotion is overwhelming you, you have to pause for a while. So how do
Mm-hmm.
you learn to know all this? So
Mm-hmm.
by increasing your skills. So is this one of the skills maybe we can say we need as a result of this pandemic? Maybe yes, why not?
Mm-hmm.
Why can't the answer be yes? Yeah. And then you have to understand that there are some things called neuropsychiatric disorders. Okay. um, Real neuropsychiatric, when you start talking about neuro, you're dealing now with the actual physiology of the body, the real
Mm-hmm.
structure of the body, the
Yeah.
nerves, the nerve cells in the brain and all of that. So this
Mm-hmm.
could be genetic factor, it could be drug abuse, could be so many things. Yeah. And then
Mm-hmm.
these neuropsychiatric disorders can lead to massive disabilities. And according to WHO reports, it accounts for 37% of loss of healthy life among the poorer nations. So what we try to say there in a package is that um, the more knowledge you know about mental health, mental illness, what causes it,
Mm-hmm.
and in what forms it shows itself, the better off you will be, the society will be. And of
Mm-hmm.
course, from Islamic angle, there's ilm fardu kifayah, there's ilm fardu ain. So I
Mm-hmm.
think this is a big chunk of fardu kifayah.
Mm-hmm.
Each one of us, we may not have time to be trained as a counselor, we may not have the opportunity to be trained as a psychiatrist and so on, so on. But we have to have some general knowledge, at least enough to take care of ourselves, our family, and our people around us. Yeah.
Datuk, when we're talking about how today in the pandemic times of the pandemic, basically, people are living in isolation, especially from one another. Prior to this, you said that the community in the old days, they are very close knitted. They live next to each other and so on.
Mm.
And with the pandemic, it makes things worse in terms of how we are progressing,
Mm.
living in isolation.
Yeah.
You also mentioned about the element of Islamic perspective on this issue. Interestingly, there's this Swiss psychiatrist Carl Jung
Mm.
in his famous book when he talked about modern man in search of a soul.
Yeah.
He emphasized the importance of religion in attaining psychological health
Yeah.
and enjoying a normal state of mental well-being.
Right.
And I believe, we Muslims, we have more in terms of this. in dealing with issues on mental health, Datuk, what is the Islamic perspective? If you may elaborate to our listeners.
Yeah, it's good that you mentioned the conventional scientists or experts' view on this. In many fields that impacts us today, environmental crisis, for example, conventional scientists, researchers are also saying that religion is a force that may help. Yeah.
Yeah.
Why? Because religion entails commitment. Religion has that power to engage the followers of that particular faith we are talking about into real action. True belief and real action.
Yes.
Belief and action. This is what's lacking. Conventional knowledge can take you to great heights. You may be discovering so many things all the time, but there is no landing point. And we say this with the greatest respect to everybody. This is not like we're shoving down people's throat. But this is what Iman is all about. Faith is all about.
Yes.
Maybe people of faith don't understand this.
Yeah.
When you say you are X, Y, a following of X, Y religion or Muslim, what does that entail? I have Iman. What does that entail? I have true belief. True belief in what?
Yeah.
So this is the critical point. So there's two dimensions to the Islamic approach that we may want to touch on today and maybe some other opportunity that we have. Firstly, just generally speaking, research shows that the effectiveness of the integration of spirituality into psychotherapy, like you said, is a reality. It's a reality in Muslim and non-Muslim countries. In the UK, for example, you can find a lot of literature that talks about this. Islam values the importance of good mental health and emotional well-being. And the Quran can be used as a guide to those suffering from emotional distress, and it can assist people to lead a meaningful and a high-quality life. Yeah? And there is no disease, the hadith says, that Allah has created except that He has also created its treatment, including mental illness. With regards to mental health and mental health situations, we do use the word diseases, right? Illnesses. So Allah says if there is a disease, there is a cure for it. So there is a cure for it. So neuroscience, when we say neuroscience, we're talking about evidences accrued from, like we said just now, the brain changes, neural changes that happen in our brain have shown that for a start, negative language, negative news, negative body language, what have you, can release stress producing hormones and neurotransmitters. These are real things in the brain. These are things that you can actually observe, you can measure, you can see the cause and effect relationship of it. So these chemicals immediately interrupt the normal functioning of the brain, leading to damage to key structures that regulate our memory, our feelings, our emotions, all leading to changes in things like appetite, and most critically, ability to be happy. So each time we vocalize, when we say we, it could be ourselves, it could be people around us, negativity, more chemicals are released in our brains, increasing anxiety and irritability. What does this, for example, immediately remind you of? The akhlaq of Rasulullah SAW.
Yes.
Was he ever somebody who irritate people, who put people down? Why is there so much emphasis on emulating him in terms of his behaviors towards his friends, his families, his wife, his children? Why is there so much emphasis on that? Because that's the best way, and that is minimum, if at all, zero negativity. So this is the way cognitive neuroscience explains how destructive thought patterns and language can affect one's mental health. So immediately already you can see there what Islam has to offer is very much in tune with, or not in disharmony with what conventional science is. And then very quickly, we do have very little time now, we have verses from the Quran immediately that you can read and say to yourself that can address your emotional situations. And you bear in mind that this is critical because 40 million Americans, for example, today are suffering from what we call massive depression. And this is the closest you can talk, or the most easy you can talk about anxiety. Anxiety is the least amount of, the most, what do you call it, the minimal kind of mental health issue that you can be talking about. So there are several that we want to share, but just one or two very quickly. Okay, read the ayat, Surah 8, number 30, for example, Bismillahirrahmanirrahim. But they plan, and Allah plans, and Allah is the best of planners.
Yeah.
When you say this yourself, if people say something that is threatening, for example, so when you calm yourself down, okay? And when you read, and it does work, like we just explained just now. This is something positive, and so it has an opposite effect to those negative transmitters that we were talking about, hormones we were talking about. And just one more last, Hajar Maslina. Verily, in the remembrance of Allah, do hearts find rest. Surah 13, ayat 28. And how do you remember Allah? By chanting His name, by repeating His name, by He has 99 names.
Yeah.
Depending on what you need, particularly Ar-Razak, if you are, you've got no money, and so on, so on. But of course, ikhtiyar, efforts is important. So I think we are very much stuck for time now. I hand you over back to our producer. Yeah. Thank you.
Right, thank you, Datuk. I think we have lots more to talk about when we talk, on this topic, and I believe the 30 minutes is not enough. So inshallah, we'll continue our conversation next week, Datuk. But you have mentioned about how Islam has come up with so many ways and avenues for us to find solace within the religion, within our iman. And when we talk about the best example, this is perfectly Rasulullah sallallahu alaihi wasallam. So with that, Dato', I thank you for your for sharing your viewpoint on this particular topic. And inshallah, we'll talk about this issue in our next part next week. We'll talk about how we as a community can help people who are facing problems with regard to mental illness. Thank you to my producer Hajar Mazina Ismail in the studio, and also to the to the digital team in the studio as well, who's helping us with this recording, inshallah. And with that, Dato', once again, thank you. Assalamualaikum warahmatullahi taala wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much. We'll talk again.